So today we resumed some surgeries and procedures here in our pretty big one. So Dr. Trawick, we'll start with you here. What will this mean for the hospital, for our patients and their families? And then Katie, if you wouldn't mind, if you would speak to the logistics, maybe the specific things that we're doing, and how we're able to continue to keep all we serve here safe and well during this time.
Good morning. Thank you for joining us. I'm Steen Trawick, and we're really excited about today. We're looking to be able to celebrate sort of the return to normalcy, as we would like to call it, where we're able to start doing surgeries again. And obviously, we're not opening up for everything. We're trying to be very selective and careful, and we're following the governor's mandate of urgent and time-sensitive procedures. If you think about what we've been through, our first case was, I believe, March the 5th here at CHRISTUS. So we're into our 7th week of this, but actually we've had about 6 weeks of where we've really been restricted on what we can do and are able to do, as well as the fact that the physicians that see our patients have also had to be limited on how they could see those emergent cases. We are actively working with our surgeons and our physicians on our medical staff as we reopen smartly to be able to see these patients and make sure that they are receiving the care that they need. What has happened is we have really struggled with this balance of making sure that the emergent cases are done, but all of the other medical conditions that these patients have had, they just haven't gone away. They've just been smoldering, and we're ready to make sure that they're receiving the care that they need. And so we're going to be working in Bossier and Coshada, as well as here in Shreveport, to make sure that we get these cases scheduled in a timely and efficient manner, but also in a safe manner. Because we want you to know that it is safe to get care here at CHRISTUS. It's safe to have surgery, and it's safe to come to our emergency department. And we want to make sure that the general public understands that, as well as our patients, because that's an important part of receiving care. So at this time, I wanted to turn it over to Katie, our Chief Nursing Officer, and she'll talk a little bit about how we're going to do that.
Thank you. Well, first you need to know that CHRISTUS Shreveport Bossier practices infection prevention practices every day. This is nothing new for us. This is something we have always done. It's been a higher priority. We've been laser focused on this now for our patients, our families, the community, our providers, and staff. We continue to focus on several things, and one of the things is our ability to have PPE, or personal protective equipment. So we talk about that daily, sometimes twice a day, to ensure that we have more than enough PPE to provide our operations. We try to have 5 days or greater of PPE. We also screen everyone that comes into our building. So our patients and families that come in for surgery, our associates every day that come in, everyone is asked the standard questions of if they've had signs and symptoms of respiratory or flu, cough, any respiratory issues. We also take their temperature and ask if they've had any outside travel in the United States. From there, if everyone is masked, employees, staff, providers, including patients, are masked at that point as well. We also have our visitor policies that will continue. So currently, we only allow essential caregivers to come and be with our patients. We do offer some other alternatives for patients who have family members in the hospital. Our patient experience officer works with an iPad and makes sure that families are getting to communicate daily. They try to give updates twice a day, and they also try to provide that service so that people can see their family members and speak with them during that time. We also ask that as patients come to the hospital for services, that we're able to allow the family members to choose to converse with us via cell phone from their vehicle rather than stay in the crowded waiting areas to create that safer environment for our families. One of the things we did set up during this time was telemedicine, and we have laptops in the people that are COVID positive rooms, and a laptop at the nurses station desk, so the physicians and the staff can communicate with these people and limit the amount of time they're going into the room and decreasing their time of exposure. And this has gone over really well, something that we're tweaking every day and learning more with the process. The other thing we did, probably in about the first 5 days of the crisis, was set up an incident command center. The incident command center meets once a day at 9 o'clock, and we have key members of the leadership at that meeting. We have people that are directly involved in patient care, nursing directors, ancillary care, respiratory, dietary, our supply chain experts, our ministry experts, our education team that has been vital in ensuring that everybody knew what the next step was as this quickly moving change with the CDCs were happening. We also have the communications team there to ensure that we're making sure that we get all of the vital information out to our staff. The Incident Command Center, towards the next week, probably the second weekend, we started meeting twice a day so that we could ensure that the things we talked about at 9 o'clock actually happen. Deliveries for PPE, deliveries of medication, making sure we had enough ventilators. CHRISTUS system has done an excellent job for us in making sure that we have had all the things we needed. And the community, Region 7, has been able to make sure that we've had everything we needed as well. And it's been a wonderful process. Now the Incident Command Center is working on ensuring we have everything we need to open up for surgery and start providing that vitally needed care. We've always been open to caring for our patients throughout this entire crisis, focused on safety and infection prevention, and we will continue to do so.
Thank you, Katie. I appreciate that. What I'd like to do now is tell you a little bit more specifically on exactly what we're doing to restore the surgical care to our patients in the community. At CHRISTUS, our primary goal is the health care of our patients in a safe environment. And as we have worked through this process, we've recognized that our patients and their family and the essential visitors that are here on our campus, as well as our staff and our associates and our physicians that are part of this team, that their safety is also important. So I wanted to cover a little bit about our COVID-19 Safe Care program. As Katie mentioned, we do have the verbal screening when you enter our campus, but also we will do this for all surgical patients that are coming for surgery. We do have antibody testing that is very unique, and Dr. Michael's going to speak a little bit about that in just a moment, but that antibody testing really helps us know whether or not you've been exposed to the COVID-19. We're doing staff temp checks to make sure that they have been screened appropriately prior to entering the workplace. And of course, it's important that the physicians document this urgent and time-sensitive nature of all of these procedures. What is very unique and good in this process is our peer-based review team. So we have 15 physicians from different specialties that actually review the cases prior to surgery. I will point out that, you know, for those of us who were around in September 11th, 2001, we will remember very vividly how our lives changed with travel. And that, in fact, a friend asked me recently, you know, how long did it take for us to get back to travel normally after 9/11? And the answer is it never did. It was always changed. And I think that healthcare is probably going to be the same way. We're going to see some changes going forward that are very different. And so as we think about how we will go forward in this new era, as we call it, AC, after coronavirus. It will not be like BC, before coronavirus. And so, Dr. Michael, would you tell us a little bit about the antibody testing, and then we'll talk a little bit about how telehealth has changed the way we do things.
Be happy to. Thank you, Dr. Trawick. So two very interesting and exciting things that have come out of the COVID-19 pandemic are antibody testing and telehealth visits that we're using in our outpatient clinics. I'm going to first start talking about antibody testing, which is exciting, and CHRISTUS has actually had it in place for several weeks now. And we've used it because CHRISTUS has always been a safe place to receive and give medical care. And we wanted this additional layer, and our senior leadership in Irving, Texas was very aggressive at acquiring antibody testing so that we could be among the first in our community and really the first in the nation to use it in a capacity that makes our hospital a safer place. So this is what everybody is clamoring for in the communities now, and what we're hearing our national leaders talk about is antibody testing. So traditionally, we've tested people initially for coronavirus with the nasopharyngeal swab, which is the only FDA-approved means of testing for coronavirus, and CHRISTUS, Highland, and throughout Bossier, Shreveport Bossier offers the nasopharyngeal testing. But in addition, we've started to offer antibody testing. And what is unique about antibody testing is a couple of things. It's rapid. We get results back in less than 30 minutes. It's a blood test, different from the nasopharyngeal swab that the other tests use. And it gives us antibody levels. In the case of our test, we're looking at IgM, which is a short-term antibody that shows you have an acute or new infection with coronavirus, and it gives you IgG protein antibody levels, which would show that you have had a more remote infection and now may have some sort of immunity to coronavirus. And our testing has been looked at by our different ministries and compared against the nasopharyngeal swab, has been found to be greater than 90% accurate in determining both acute and remote infection with coronavirus. So we have rolled it out in our hospitals in a limited fashion because we don't have a huge supply, but we've rolled it out in a way that has made our hospital a safer environment. The first is, of course, we've used it in our patients who come through the emergency room and get admitted to the hospital. It's been used as an additional screening test before a nasopharyngeal swab, and it's been used to also double check someone who's had a negative nasopharyngeal swab. And we found it useful in multiple different situations. For several weeks now, we have been using it to screen our urgent and emergent surgeries that have been done at this medical center. And we have actually used it to make decisions to delay surgeries when we found somebody who has an early or asymptomatic infection, so that we would keep the operating room a safer place and keep our associates from getting exposed to it. And then we've rolled it out in a limited fashion to test our frontline employees who have been the backbone of our response to COVID-19, in the emergency room staff, some of the COVID unit staff, some of the critical care staff, some of the radiology staff, some of the phlebotomy staff. We're starting to roll the testing out to try to capture all of these people who have been the ones who had the most exposure to COVID-19. Our hope is that, and we know that in the near future, it's going to be available to the entire community, both through CHRISTUS and through some of the private vendor labs. And there's a real excitement and demand from the community to know what their antibody status is. And we wish we could test everybody, but right now we have limited supplies. It's a very precious resource, and we're using it to make CHRISTUS Highland a very safe place to come and receive medical care. The next topic I'm going to touch on briefly is telehealth. So we've talked about telehealth in outpatient clinics for years and how we could utilize it, and everybody was somewhat intimidated by it, starting to use it. The one thing about COVID-19 is we've ripped that Band-Aid off, and we have learned how to use telemedicine in our clinics to help render care to patients. So there's a couple of ways telemedicine helps. Obviously, you get to have a face-to-face discussion with your doctor so that you can let them know if you have cold-like symptoms, or if you're having trouble with your diabetes, or if you're having issues with heart disease. All of these things can be addressed in a telemedicine visit through an outpatient clinic setting. And Dr. Trawick and I were taught years ago that if you just listen to your patient, they'll tell you what's wrong with them. And so telehealth lends itself to that, that you can listen to what your patient's telling you. Unfortunately, the technology is not quite there that we can listen to the heart and lungs, but if there's something concerning or we determine that blood work is needed, then arrangements can be made for that person to come into the lab or come into the clinic and be seen in a more traditional fashion. And in doing telemedicine, we're keeping a lot of people out of the waiting room. So if you do have to come to the clinic, your visit's going to be in a very isolated fashion, and you're not going to get a lot of exposure, and social distancing will be maintained in your visit. So it's been a very exciting thing that our CHRISTUS physician group practices have utilized, and we're planning to continue to utilize it moving forward. And it's important for patients to know that it's part of your permanent medical record, and most all insurance companies are covering for it, including Medicare and Medicare Advantage plans. So it's really become the mainstream of medicine now. We're excited to figure out new and better ways to use it as we move forward.
Thank you, Dr. Michael. With all that being said, we are, we've learned a lot through this process, being able to isolate patients, to make sure they get the care that they receive, but that there's not the commingling of other patients that are here on our campus. But we have had a wonderful response with this new testing. And I just want to be perfectly clear that it is safe to get your care at CHRISTUS Shreveport Bossier. And here at CHRISTUS, we're ready to move forward into this next era. 125 years ago, Dr. T. Schaupert started what we call CHRISTUS Shreveport Bossier now. And he started it with the sisters and have grown into what we have currently on our campus. And that's great, safe care in both Shreveport, Bossier, and also in Coshada. And we're very proud of that care, but we want to make sure, because we've heard from several folks in the community and our friends and our patients and folks that we are at church with, even though it's on Zoom now, we've heard from them that they're concerned. They want to know, is it safe to come to the hospital? And absolutely it is. And we want you to know that if you need medical care, it's okay to come here, and we're going to take good care of you, and you're going to be safe. So with that being said, I'll close now, but I want you to realize that, within, just like from a month ago or 6 weeks ago, 2 days ago, as well as 2 years ago, we're going to do the same thing. We're going to take care of sick people, and we're going to do it in a safe and efficient way. So with that, we're happy to take any questions that you might have.
All right, this is Will Knous again, and I will let you know everybody can ask their questions via the chat feature on Zoom. It's at the bottom. It'll show up on the right-hand side when you click it. You ask your questions there. We'll call on you, and you will be unmuted, or you can unmute yourself, ask your question, and then please mute yourself again. And if you are, again, not asking a question, please remain muted so the camera does not change. Our first question will come from Brad, and he's asking about what types of surgeries and procedures will be starting back up at CHRISTUS, and will they be available at all CHRISTUS locations? So Brad, if you want to address that question to the group.
Yeah, I don't know if y'all can hear me. This is Brad Cesak at KTAL News. Yeah, I just wanted to see kind of what procedures will be starting back up, starting, I guess, today, and if those are available at all CHRISTUS locations in our area, or if they're only available at certain places, as we go forward, through the rest of the pandemic.
Thank you for your question, Brad. I think that's on everyone's mind. And as you know, when this began, because of social distancing, people were not coming to the doctor quite as much. And only emergent cases were being done here on our campus. We also had to limit just regular outpatient visits and procedures in our clinics and also the outpatient clinics. So a lot changed there. Just this past week, we were given a little bit more leeway and understanding on what is now acceptable surgery. To say that this surgery is acceptable or that surgery is not acceptable is difficult to say, because I think that would be a little generalized and broad at this time. But suffice it to say that the time-sensitive procedures that we've been putting off for the last 6 weeks, as well as the urgent procedures that need to be done because of a chronic condition that's gotten worse, or an acute condition that maybe has been smoldering for a few weeks, those are the cases that we are looking at getting scheduled. As I mentioned a little bit earlier, our peer-based review team that Dr. Michael actually heads is working hard, because we have representatives from each specialty to review these cases and make sure that we're staying and complying with what the governor and the Louisiana Department of Health has mandated.
All right. And if everyone would please, again, please mute your mics as soon as you're done asking your question, or if you have any other follow-up. Is there any other questions? No other questions from the group? Okay, I guess if everyone is finished asking their questions and no one has any follow-up, you can always email me. My email address is in the appointment for today's meeting. So if you need anything, please follow up there. We have a recording the meeting today, the press conference from Zoom. So if you need that, please email me. We can follow up with a digital recording of that. And then thank you to our participants today for attending. We appreciate that greatly. And Dr. Trawick, Dr. Michael, Katie, if you have any last questions or statements you'd like to make, do you have any follow-up thoughts that we'd like to add?
I'll just say thank you for joining, and it's important. You're an important part of this rollout and making sure that our community and our patients understand what we're doing here and the safe nature of healthcare. And I appreciate your part in all of this. And I'll turn it over to Dr. Michael and Katie.
It's a privilege to provide care to this community every day, and we are so grateful for everything this community has done for us during this time. We have received food and masks and so much that our staff are deeply touched, and we appreciate everything you've done for us during this time.
I concur with that. It's been an amazing time here to watch our associates step up. You take for granted how good this hospital is, and really all the hospitals in this town, but this one in particular. But when you get in the middle of a pandemic like this and it's a crisis situation, you really see how good the people are here. I just want to thank the community for all they've done to support our associates and our medical staff, and let everybody know that we are open for business and it is a safe environment. We look forward to taking care of you and your family moving forward. Thank you very much.
And that concludes our meeting for today. Again, if you have any questions, my email address and phone number is in the appointment for today, and we can follow up with any questions that you may have. Thank you so much.
Will, there looks like there was another question from Brenda that popped up.
Ah, yes. Brenda, if you want to speak up and ask that question, I think we can get you unmuted.
Sure. Thank you so much. Just quick question on what segregation has been established inside the hospital to make sure the COVID-19 patients are segregated from those who we know are non.
So currently, pretty much since week one, we have a hall that is dedicated to the COVID patients. There is a PPE area for downing, what we call downing, putting on our PPE, and doffing. There's a particular way we remove our PPE to be safe. So we have a downing and doffing room right outside of that area in a very specific way that marks that you're going into that area. So staff and providers stop, think, and they're very calculated in how they approach those rooms. We also have that in our medical ICU, where those ICU patients are kept. When a patient arrives to the emergency room, we no longer question if they are or are not COVID positive. We automatically mask everyone. And that patient is kept in isolation or in a private room until we get results back to determine if the patient could be COVID positive or negative. But we've done an excellent job in providing that process.
And Brenda, I would also add that, although we're seeing the numbers decrease, as we start to open back up, we do not want to see a resurgence of this. Everyone needs to be very careful and continue the social distancing, to continue washing your hands, continue staying home when you're ill, or at least getting in touch with your physician about that. But making sure that if you do come to the emergency department, let them know if you have symptoms early on. But we're taking those extra measures to make sure that patients are separated with symptoms and with the positive test away from those that are not.
Thank you.
Thank you.
All right, any last questions? Okay, thank you all for joining us today. I appreciate it. And again, thank you. If you have any questions, follow up via email or phone. It's in that appointment. And have a great rest of your day.